I think this topic has come up again and again all morning. I'm curious, with a show of hands, how many of you? Did I not turn it on?
Yep.
Oh my goodness. How many of you are disturbed by the proliferation and growing of health misinformation that exists in the world today? How many of you? I think all of us up here sort of share that, and this conversation today is going to be a bit about level setting where we are with the problem, but really focused on what the solutions can be to that and the power of storytelling to overcome that. I'm Derrick Weisberg. I'm the Global Chief Creative Officer of Havas Health, which is the world's largest health and wellness communications company. We're 6,000 people around the world focused on health, working with so many of the clients around the room today. So that's me. Dr. Andrews, let's meet the rest of our gang here.
Sure. Thank you so much, Eric. And thank you to BDO.org for this incredible opportunity. Really pleased to be here with this esteemed panel to really talk about something that is near and dear to my heart. So my name is Emma Andrews, and I lead global patient advocacy at Pfizer, where my team sets the strategy on how we engage with global patient advocacy groups around the world. And these groups are really leaders within their communities who are at the forefront in the battle against health misinformation. So really excited about the conversation we're about to have.
Amazing. I'm Andre Gray. I also work at Havas, Chief Activation Officer, Head of Culture and Entertainment at Havas Links. I am excited about bringing more of these conversations into content, entertainment, the places where we already go. I was saying to this last night to Will, people are going on Duolingo and learning High Valerian. Instead of that, they should probably learn about asthma, and diabetes. So we have a lot of opportunity to transform the way that we communicate. And I think platforms like BDO are going to be at the forefront of that. So really excited to continue to put the information we need in places where we want to have it.
Thank you, BDO, for including us in this conversation, and congratulations on the 10th anniversary of this event and your 20th anniversary as an organization. I'm with the Patient Advocate Foundation. We're one of the nation's largest comprehensive safety net healthcare charities. We provide assistance to hundreds of thousands of patients across the country. We reach at least one person in 90% of all the counties in the country. But we also know that all too often in this country, those who need the most, get the least, or they get it last, or both. So we've set up programs around research, around education and engagement, as well as policy to help the healthcare system work better for those patients that radically need it to be different and work better for them.
Well, hey, I'm Derrick Lane here, Chief Marketing Officer at BlackDoctor.org, and man, I love what every one of these panelists are doing, so I'm excited for the conversation today.
All right, let's dive in. So let's sort of level set where we are today, and all of this in this conversation today is inspired by a piece that Dr. Andrews wrote in The Guardian, which you should all read, about outlining the core of where misinformation has come from and the crisis of trust that is driving disproportionately poor outcomes in communities due to that. So let's just talk about where we are. We're living in the golden age of health information. There is more health information in more places than ever before in human history. Yet at the same time, with that comes the golden age of misinformation, where 60% of information around, according to WHO, 60% of the information around the pandemic on social contain false information. A third of the information around oncology contains false or misleading information. All of this is then powered by our growing distrust of our media organizations, the mistrust of our governments. And this opens up this incredible opportunity for brands to become a core part of the solution. The trust in brands continues to grow, and there is both a benefit to that in terms of getting more trusted information, but there is also a huge benefit to brands from an investment in this kind of information, because one of the interesting things is the number 3 thing after cost and quality for why people choose brands is that they're brands that they trust. And so a huge opportunity for us today together to think about how to solve this. I want to dive in, as you're the inspiration, Dr. Andrews, to all of this. Help us understand how we got here and where we are today in terms of this, and how the misinformation is impacting patients.
Thank you so much, Eric, for that question. And perhaps I always like to start by level setting, and I think in this room we can all agree, but I'd like to say, when you think about misinformation, it's false, inaccurate, or misleading information based on the best accurate information, that's the evidence that's available. Different from disinformation that is, so it's without ill intent, compared to disinformation that's really spread with the intention of harm. But we know that both of these—
Back to where Reggie started the conversation this morning.
Exactly. But we know that both misinformation and disinformation, unfortunately, have really led to a breakdown in trust with the public. So to put it into context, you talk about the systematic review that was published in the WHO bulletin about how really when you go on social now, a lot of the information with vaccines of pandemic, 50% for vaccines, 60% for pandemics, is false or misleading information. And we know what that does to communities. So I'll give 2 examples. I think we all recall the Ebola outbreak in West Africa in 2014 and 2016. Unfortunately, because of misinformation, there was a delay in containment of that outbreak. And because of misinformation, there were rumors around Ebola, the vaccination against Ebola, causing infertility in women and impotence in men. And we know, but at the end of the outbreak, over 28,000 people had been infected with Ebola, and 11,000 people died. And a lot of these deaths could have been avoided had we not had the rumors spread with this information. So that's a direct impact. But we don't have to go to West Africa for that. I think looking just where we live in the United States, let's go back to COVID. I mean, a study in 2021 showed that vaccine hesitancy to COVID-19, there was because of the misinformation, there was 20% increase in vaccine hesitancy. And we all know we don't have to look far to see what that impact had on our communities.
Yeah. We're seeing it every day.
We're seeing it every day.
And Oklahoma.
Exactly. And now, present day, measles again. I mean, measles outbreak. And so, I mean, I think we know what the impact is on misinformation. And, but I feel that there's a role for us to all play. So I'll stop there and pass it on, but I'm looking forward to continuing the conversation.
Right.
And what can we do about it?
Well, look, I think I appreciate the sort of level setting of sort of how this started, how we define what that is. Look, I think every single person sitting in this room wants to do something about this. It's why we're all here today. I think it's why misinformation started in the first panel today, into the second panel, and now into ours. Let's try to make this shift now into thinking about what we can all do about this. And I think, Andrea, I'll look to you next. I think one of the things that you think is an opportunity is to use creativity and storytelling, and not in the way that is done before, but use creativity to transform how we're telling health stories to try to close this trust gap. Can you talk about how brands might do that?
Yeah, I mean, I think, I always come back to the statistic, 55% of content is not ad supported, right? And I think it's particularly with healthcare marketing, just as a consumer and a person on the outside, right? Like, how many of us have been in this situation? You're watching March Madness, you're watching The Bachelorette, and they're like, yeah, and also in the middle of this, if you get this thing and don't deal with it, your toes are gonna fall off. And you're like, bro, What are you, come on, man. It's Sunday night. I'm trying to relax. I'm worried about work tomorrow. That's not what I'm trying to deal with. It's right message, wrong time, right? I always say, never print the owner's manual of your car on the side of the car. I don't even know if I like the car. I don't need to know how the gear shifts work right now. I want to see if it looks cute, right? And so we're constantly pressing against the wrong information in the wrong moments if you prime someone for it, right? So let's say I'm watching Abbott Elementary and the next character is a teen that has asthma. I'm going to take that the same way that, any other B, C plot line that we've seen in a movie. But now I'm learning, oh, damn, that's what you're dealing with. That's the same thing that my cousin's dealing with. They were wheezing like that before, right? And so you can use these platforms to easily tell a story that then against that story, now you hit me with the ad about asthma and whatever it might be. And I'm like, this all makes sense now because I've been primed for it. I've been paying attention to it. And it's not this jump scare that's in the middle of, you walk out the room to go to the bathroom and they're like, and you're going to die. And I'm like, fuck, bro, like, stop. It's too much. I don't want that. So I think the opportunities are there, but we have to really be creative, not only in the way we tell the stories, but creative in the way we think about integration and the real life cycle. And I think it comes back to, especially what Rhonda was saying, right? Inspired by people, right? Real people want certain information. We all want to know about health. We want to know about our cars. We want to know about the weather. Just give it to me at the right time of day. You know what I mean? I just woke up. I don't want that right now. I would like that when I'm prepared for it.
Yeah. So not more fear and shame.
Yes, the fear and shame. The thing that's so asinine about the fear and shame, and I'm sure you would agree with this, it scientifically doesn't work, right? Oh, well, if I tell you it's going to be worse, that doesn't work. Negative motivation does not work. Positive motivation works. So why are we still doing stuff that we are all supposed to be scientifically driven, but we know psychologically it doesn't work?
Yeah. Agreed. Shifting gears just a bit on this to where this content will live. And Derrick, I sort of think about the power that blackdoctors.org has to sort of combat this. But I also think about the fundamental issue. Gallup has looked at our trust in media. It's eroding from a place where about 40 years ago, roughly 75% of people trusted their media sources. We're down to an average about 30, according to Gallup. If you look at some subsets of that, it dips down to like 12%. So I think what's really interesting and powerful about what you and the team at BDO are doing is you're looking at specific things on the platform to combat misinformation. Can you talk some more about that?
Yeah, so like you said, the times have changed. The currency of production. Before it used to be like, okay, who can create the slickest ad, or have the greatest tagline, or have one of the best jingles. But that currency has changed to the currency of authenticity. The best thing about the internet is that everybody has a voice. You know what the worst thing is? Everybody has a voice. That's the problem. So we at BDO, we want to amplify those trusted voices that we have in the community. And we do that every day, but we had to also earn that trust. What we're combating the whole, well, I heard this from my cousin, or Pookie and them down the street said that you can get this from that. We've got to combat that every day, but how do we do that? We do that with the trusted voices like we have in this room that we are able to amplify. But we're also catching people where they're at. Like Andre said, hey, if they're on Instagram, if they're on Facebook, if they're on TikTok, let's put those trusted voices there. So then you can use that old proverb of win the person, then teach the point. So you're already there, but then you're able to talk to them in a way that they understand from the people that they trust.
Yeah, I think it's so important, and it really is an incredible part of the work you're doing about amplifying those voices. I come back to you, Dr. Andrews, for a moment, which is, I think these amplified voices and sort of changing where people get information from is a core part of that, particularly in a world where AI is only amplifying the biases in news and information in general. patient advocacy groups become a huge part of where people can get more trusted information. And right now, the access to that is probably not what it should be.
Yeah, and I'll just build up on everything that's been said here. One is really, meeting people where they are. But also before I answer that question, I just want to say, I think it's also really important for us to educate people around the differences in media. I feel like the way we access media has changed. I mean, when I was in school and training, I didn't think that one day TikTok would be a go-to place for health. So, I think we have to meet people where they are and have them be critical analytics of how, what types of information this is. Is it a credible information? Is this an advertisement? Is it sponsored? Who is paying for it? All these other things that we might not think about. And then when we talk about these trusted sources, I go back to, when we think about patient advocacy leaders, they're really, for us, when we think about a brand like ours, it's really that trusted bridge between us and patients, because they understand the patient journey. A lot of them, it's personal, and they're also they're more aware of the culturally sensitive nuances that need to happen there. So sometimes I feel like we need to get out of the way. We might have the facts, but we might not be the ones that need to tell the story. We need to step out of the way and empower our community leaders, empower those trusted community to tell that story on our behalf.
Yeah.
And this is the focus of your work, Alan, right?
Yeah, go ahead.
Okay.
Oh yeah, no, I was just gonna bounce off of that. I think it's two things, right? I think one, what I really am disappointed in is we're not using the academic method when it comes to sources of information, right? I think the way that we're thinking about things from a misinformation, disinformation standpoint is we want to stop the information. You can't stop it from hearing stuff. But when you hear something, you got to fact check it, man. Go check somewhere else. I know when I grew up, going to school, right? I had the privilege of going to Amherst College. It's like any information you have. Okay, now let me double check, cross-reference that a couple of different times, check the comment section. Like, we have to take more personal ownership, I think, on the information that we're receiving so that we're double checking and triple checking. And the other point that you make and dovetailing into what you're going to talk about, I'm sure, is know who's your audience and know who's speaking, right? Yeah. I think a lot of times as brands coming and coming into it, the old school brand mindset, I own the brand, I'm in charge, I'm the big boss, chill. You don't own anything, right? If we all decide that we don't like it anymore, we don't like it anymore, right? It's in the zeitgeist, right? And so I think what's particularly tricky for brands with the best intentions, Pfizer, it's a PWI, it's a predominantly white institution. You're coming into a space, I don't want to hear from you about certain things. I don't think that you are a credible audience about that. Let me have someone else speak on your behalf, right? And how do you empower the advocates, patient advocacy, but also just even in a messaging hierarchy? You can't just put a Black spokesperson. You have to build that authenticity and trust. And that's super important. Is just keep in mind, who is the one who's talking? Because I'm not going to hear everything from everybody. That's just not how I work as a human.
So building on that authenticity and trust, we spent a lot of time over many years qualitatively and quantitatively trying to understand sort of two related elements. One is that trust factor, and the other is the information. And what it boils down to across the patient population when it comes to building trust, patients want to feel respected, they want to feel listened to, and they want to feel like their care is personalized to them. There's a lot of ways to personalize care. And then you flip to the information side, right? And I think we can all agree the goal of healthcare should be to get the right care to the right patient at the right time. And part of that's about the information, right? And we think too often about getting the right information to the patient at the right time, when really what we should be focused on is getting the right information from the patient at the right time. And that means radically rethinking and prioritizing the information set. Yes, patients obviously want good clinical efficacy and safety, and that's the clinical piece of the information. Well, guess who's the expert in that? It's those that have been trained 20, 30 years in practicing that expertise. And too often we try to make patients mini scientific experts and doctors. The whole idea of health literacy is based on that idea. And too much of what we're trying to do is get information to them about that clinical piece. It's not that it's unimportant. It's just there's a whole nother information set we have to make room for. And that's what the patient is an expert in. It's who they are. It's those uncomfortable conversations that we have to have. Empowering patients and engaging them and teaching them and training them how to tell their story in a way that's clinically relevant about what's important to them is absolutely essential, but we have to create that space, that receptor site in the clinical experience where that information set is needed and is prioritized. It absolutely has to be there. And the way we think you could do that is rethinking, and maybe we'll get a chance to talk about this more, but radically rethinking the whole idea of shared decision-making and making sure that the patient information set is just as valid as the clinical information set, because you need both and to bring them together in order to get the right care to the right patient at the right time. You cannot do that without getting the right information from the right patient about that care at the right time.
Yeah,
100%.
and I think 100%. And I think the interesting shift in all of this, I think, is how to have those patients have better information when they come into the office. And I think when we talk about the power of storytelling, when Andre, when you talk about the integration of these stories into entertainment, when we talk about the shift from shame into the positive impact of this, it feels like that means a fundamental shift in how we create content on BDO, in other places. What does that look like?
Yeah, I mean, I think we're seeing a shift right now, right? Because when you see places like TikTok considering themselves to be entertainment platforms, and what I'm seeing is people taking more time with the quality of the stories, but keeping them germane to the different mediums, right? So when you go on Instagram these days, you'll see the start of serialized content shot. You know, it's the same as a White Lotus. We were talking about that last night, right? Yeah. It's got that same cinematic quality, but it's 1 minute long. It's 2 minutes long, but it's multiple episodes. It's in a series, right? So we're using the kind of tropes that you understand. Hey, this is 1 minute of a series, episode 3. Oh, I know there's going to be more episodes. I know the context that I'm in. I'm not expecting this, right? So we're giving wayfinding tools to people in how they ingest and digest the content, but now trying to elevate the quality and caliber of it, because also we're all humans. We're primed for things. If I turn something on and it just looks like a guy talking into a camera, okay, that's one set of information. I'm going to assume some authenticity. I'm going to assume a little bit of skepticism, at least me personally, maybe some other people not as much. If I see a cinematic caliber, then I know, okay, this is archetypal storytelling. This is something that I should understand on a moral and larger level. So I think the way we tell the stories is really dynamically changing. And I think we really have to change the process that we go about coming up with the stories, right? What is our testing process? Like, just to be a little bit in the weeds of kind of the brand marketing side of it, we're so concerned, to your point, we are so concerned that if we have as smart, we're some of the smartest people, you know, you said it earlier, we're some of the smartest people in the world in this room. It does not matter. Think about you're talking to your kid. It does not matter how correct your information is, right? But we approach marketing every day like, oh, hey, this is the right MOA. This is the right modality. If you just knew that this thing would change, it does not matter. I'm in line at McDonald's. Why are you telling me about my skin right now? It doesn't matter, right? Just being correct and out of context is not going to land. You have to prime your audience. You have to respect your audience. You got to talk to them like they're a person and make sure that you have the right vehicle to convey that message. And we're just at the beginning of it, but it really, really is going to be a Herculean shift in the way that we go about the marketing process, right? I think that the work that Dr. Andrews is doing, patient advocacy, that should be the center point. That's not just oh, sorry, I already did my whole campaign and hey, look, let's just get some advocates in here. No, I'm sorry. None of that expensive stuff really matters unless you're hitting with the people.
And I just wanted to piggyback on that and say that, you know, for us, you know, it really starts, and I think it's been mentioned in the other panels before us, it's like, we really need to listen and learn from the patient perspective. And I mean, we say it lightly, listen and learn, yes, listen and learn, but we really, really need to listen and learn. And it comes down to that shared decision-making, because at the end of the day, those insights that we get from patients really inform the way we do our work, from the earliest moments in discovery to when a prescription is prescribed anywhere in the world. And also when I think about this whole, how do we, you know, people talk about engaging patients, but really for me, I feel like we need to go beyond that. And I think other panelists mentioned this as well, to move to empowering patients, because I really truly believe an empowered patient will show up differently. They'll show up differently when they engage with their physicians, with regulators, with policymakers, because they are empowered.
Yeah.
And when I look at all of us, sorry, I'm kind of like going off script here as well, but I also feel like this whole misinformation piece or how patients digest information, we have to take the onus off of patients. It's really up to us. It's not up to the patient. It's really up to us. If you're a healthcare provider, if you're in the healthcare system, really, it's up to us to make sure that we talking to patients in a manner they can understand and that lead to activation. Because that's empowerment. So to me, if you're a physician in the room and you're at the front lines, how about we do vital signs when your patient comes in? Maybe there's a fifth vital sign. And that's really assessing the level of health literacy for your patient before you go into conversation. Where are they getting their health information? And I know, listen, you usually only have 5 minutes with your patient. I get that. But then the onus is on all of us. For us brands, what tools can we create to make sure that in those 5 minutes, we empower then the healthcare providers to be able to have these conversations?
Yeah.
So to me, that fifth vital sign is around assessing health literacy for your patient.
I mean, I feel like we could have this conversation for another hour and a half. I'm getting a flag that we need to wrap this up. I just want to sort of close this out with something from each of you. I mean, first, I'm hearing a shift from traditional content creation into what we'd call welltainment, edutainment, a shift in what that. I'm hearing patient empowerment needs to be at the center of this. I'm hearing that it's about what we get from patients, not just what we give to patients. And I love this idea of this fifth vital sign of like if a patient walks in and a doctor is not assessing their understanding of the issue before we start talking about solutions, we've sort of missed the mark from the jump. I mean, working backwards, a thought from each of you to wrap this up. What's the one thing that we can all do tomorrow to help change the course of where we are in the world of misinformation? Derrick, maybe you can kick us off here. What's the one thing we can do tomorrow? Spend more money on BDO.com.
Besides going to blackdoctor.org, I would say just to piggyback what I think the theme is today as well, is to listen. You know, when we first started out with BDO and I came on board, for 2 years, we didn't do anything else on social media except for ask questions. Each and every day, open-ended questions about what people were feeling, how they were doing, what they were doing in their life, just to gain those invaluable insights that you were talking about. And then we started to shape the messaging, the stories, the listicles, all of that around what they wanted. So being able to just simply listen to the stories from people, but also we have the power to combat it. So just like Andre said, just a simple thing. What's your source? Where'd you get that from? Hey, did it come from such and such? Where are all those sources referenced from? Just questioning where you are. It's okay to be the aggressor when it comes to the health of our families, our communities, and the people we love. Let's be the aggressors and start to question those things in order to combat misinformation.
I love that.
Yeah,
Listen first.
Yeah, based on that theme, I think we need clearly identifiable and knowable steps in the patient's healthcare journey and in the clinical process where that patient information is supposed to be gathered, where there's an opportunity, nay, an obligation for the healthcare system to listen to the patient and to listen to them about the most personal things they have in their lives, who they are, what matters to them. You cannot deliver personalized care without listening to a patient about what is the most important thing to them. And their story is important, but what it really boils down to is what's important to them for their work experience, for their transportation journey, for their food journey, for their childcare journey, whatever it is in their life that we know is going to come between them and equitable access to their healthcare. We need to have those very hard personal conversations throughout the healthcare process in order to personalize their care to meet their needs.
Yeah, I agree 100%. I just ask you a quick follow-up, which is to say, what's the one thing people can do tomorrow to work with patient advocacy organizations to get there?
I think figure out how to tell your story in ways that are meaningful to your healthcare providers.
All right, well said.
Call bullshit on yourself, on the process, right? Like, we are not going to get to the outcomes that we want in a landscape that is changing faster than ever before in history unless we're trying to innovate. And the problem is that whenever you're in a big organization, so healthcare, Havas, Pfizer, BDO, we all work within these organizations and systems are built to replicate. They're very, very fancy photocopiers. So if there's not people saying, oh, hold on, does that still make sense? Might have made sense yesterday. I don't know if it makes sense today. So call bullshit and do it to yourself, but also do it in your teams, do it in the rooms you're there. Because if we're not stopping the trains to just say, hey, is this still making sense? We're never going to get to the outcomes we need.
All right, Dr. Andrews?
First of all, I agree with everything everyone said. And I'd say also that, when you're in a room creating solutions, look around the table and say, do we have patients at the table? Do we have community leaders at the table? If not, you better stop. Because what we do is for patients, we need to do it with them.
I love it. Listen, call bullshit. Put the right people at the table. Work with patient advocacy groups. Thank you all so much for being on this panel. I've learned
Thank you.
That's your listicle right there.
Oh, yeah. Oh, he's got you. Yeah. Oops, let me button this up. There we go.
You don't want to know we were.
There we go. Thank you, sir. Thank you. Thank you all.
Jay's gonna do the connecting moment until I push the launch.
Okay, cool.
1, 2. Check 1, 2. Check 1, 2. Can I get a little volume?
Yep.
On 7. There we go. Here we go. Go ahead, Jay.
Well, how are you all feeling? How are you feeling after this morning? We heard some powerful things, yes? Can we get a round of applause for our previous panelists, our panelists from this morning? Well, now I think it is time for what is probably our favorite part of the day, lunch. We get to eat. So if you head out in this direction, we have